now. Thank you.
All right, thank you. Good morning, good afternoon, and good evening to everyone who's joining us today. It is my joy to welcome you to this panel event at the Women Leaders in Global Health Conference. But what we'll be speaking about is how women are taking actions to challenge power and privilege for health, for gender equity in health. And we are joined here by several chapters from Women in Global Health across the world that will share with us their experiences around this topic. Just to highlight that Women in Global Health is an organization that is a global movement that has the largest network of women and allies working together to challenge power and privilege for gender equity in health. It started in 2015 and has now grown to include over 50,000 supporters across 90 countries and has 40 official chapters with a strong presence in low and middle income countries. I will not delve more into this, but I would like to say that if you'd like to find out more about Women in Global Health and its chapters, we also have several networking tables happening at the course of today and tomorrow. So feel free to check the main agenda for the conference and join us at the tables to find out more about what we do. Since in the interest of time, what I'll do is I'll just hand over to the moderator so that we can get started with knowing our panel and with the conversation that we have today. We really look forward to having a great discussion with you all, and we welcome you to share your views as well in the chat section and just engage with us as well. So over to you, Tikhala.
Thanks, Mwende. Very, very excited. Good morning, good afternoon, good evening, as Mwende said, to this very exciting, stimulating session on women-led movement, challenging power and privilege for gender equity in health. Two key issues, privilege and power, in the work that we do. I know we have different audiences joining us today, but my hope is that you get to just hear the experiences of different women leading Women in Global Health chapters in different countries, hearing the experiences, hearing just some lessons on how they're doing it when they're leading change and leadership and driving movements at the country level. So I'm really excited. I'm your moderator, Tikhala, Itaye, for this session. And please make sure that you have your comments and your reflections just shared on the chat. We only have about 30 minutes for this session, so we'll be brief, sweet, and hopefully very inspiring. So I'm going to kickstart this session by firstly just getting our amazing panelists to briefly introduce themselves. So we're just going to go quickly in just one sentence, your name and what do you do. So starting off with, let's start with Dr. Preethi.
Thank you. And I'm very excited to be here. I'm Dr. Preethi, co-founder of Women in Global Health India. I'm also the director of the Chitkara Global Health Institute in Punjab, and also a Harvard Lead Fellow with the Harvard Global Health Institute, and really looking forward to this discussion. Thank you.
Thank you, Dr. Preethi. Can we also have Dr. Choolwe to come on?
Thank you. Good morning, good afternoon, wherever you're joining us. My name's Choolwe Jacobs. I'm the country lead for Women in Global Health here in Zambia. This is where I'm based. I'm also a lecturer and a researcher in the School of Public Health at the University of Zambia. It's a pleasure to be in this meeting today, in this conference. Thank you.
Thank you. Can we now have Dr. Nicole?
Hi, everyone. I'm Dr. Nicole Fouda Mbarga. I'm an epidemiologist. I work with the World Health Organization as the focal point for cholera control. I'm really passionate about gender, and I'm the chapter lead for Women in Global Health in Cameroon. Thank you for having us today, and I look forward to this exciting conversation. Thank you.
Thanks, Nicole. And last but not least, Becca.
Thank you, Tikhala, and good morning, good afternoon, good evening, everyone. My name is Becca. I am the co-founder and co-lead of the Women in Global Health chapter based in Chile, and I'm really looking forward to this discussion with all of you.
Thank you to our amazing panel. oh my goodness, we have amazing expertise here, just listening to the background and just the diversity from the different countries you're all representing. So we're going to kickstart this conversation. This is really an informal conversation to just learn from each and every one of you. I'm sure even the audiences listening here is just so keen to learn about how you do it, right? And firstly, we want to know from each and every one of you, as members of different Women in Global Health chapters, we want to learn more on your chapters and its members. How do you organize for change in health? And I will start off by asking maybe Becca.
Thank you, Tikhala. Yeah, I think the organizational part is definitely one of the most challenging, the most exciting parts of being a Women in Global Health chapter, bringing together members from different walks of life, as I said, is challenging, but is also something that really brings the movement forward. So the way that we've organized ourselves in Chile is that we have a very transdisciplinary and also intergenerational team. We have people from healthcare workers, midwives, doctors, but also sociologists. I'm a public health professional. So we have people really from everywhere. And something that's really strengthened our chapter specifically is that we have lots of women who have been involved as activists in healthcare worker syndicates for many years. And they have really brought their expertise from the work that they have done to mobilize for change for many of them decades into the chapter. And that has really given us a lot of power to enact change now with all of the expertise that they bring from earlier on.
Thanks, Becca, and I'm glad you talked about power, because this is the session that we're having right now. Really thinking through how power and privilege plays in the work that we do in gender equity in health, and just touching on the collective engagement among members in different chapters like yours when you're organizing. I'm curious to know more about organizing at country level within the Women Global chapters. Let's hear from Dr. Choolwe.
Thank you so much, and glad that Becca has started in mentioning on how the chapters are working. And I should indicate that the pattern is quite similar, but just to add on how we engage women and ensure that everyone is actively engaged. So what we do, probably I will start by talking about the walk the talk. So for the Women in Global Health Zambia, we walk the talk in that in as much as we are advocating for gender equity, we are saying, men, come on, get on the board and join us. So it's organized in a way that it has a gender equity lens. We are not segregating. We have both women and men that are actively participating, including in our management committee. We do have a man in there. The members, we have the male being involved. But also we have tried by all means to ensure that everyone is actively involved by coming up with thematic groups. We realize that women have different strengths, they have different interests. So we do have an advocacy team. We have a thematic group for research. We have women that are very interested in research. So this is to ensure that everyone is actively involved. So women identify themselves in a thematic group that they are most interested in, and that makes them work better. I think that's what I can say for now. Thank you.
Thank you, Dr. Choolwe. It's interesting you were saying that. I was sitting here and I was like, for those on Twitter, hashtag walk the talk and hashtag gender equity with women and men. And it's always interesting because the word women has the word men in it. So, even when it comes to issues of advocacy and dismantling issues of privilege and power, including men and boys is so critical to the work that we do. And I'm keen to even learn more about the experiences with Nicole on some of your work around Women in Global Health Chapter in Cameroon.
Thank you for having me again. So how do we organize our chapter in Cameroon? We have an executive board, we have honorary members, and then we have an advisory board made up of 50% of males and 50% of females. We recently came up with a strategic plan, and our main objectives are to contribute to the understanding of gender equality, because it's we've realized that people tend not to understand what is gender equality and feminism. So it starts by educating people, raising awareness. One other thing we do is building capacity for everyone, but we have a focus on females. We have a virtual classroom for leadership in health, hosted at the University of Washington. So we usually organize capacity building sessions on leadership, menstrual hygiene, management, and poverty. We are a network. We share opportunities for members to grow up. We also contribute to the visibility of women by allowing them to participate in conferences at the national and international level. And also we contribute to strengthening the health of women. We are really active when we talk about gender-based violence. We've conducted a social media campaign online. We've done the same for breast cancer. We've provided recyclable pads for internally displaced ladies who actually face menstrual hygiene poverty. And we also sensitize about, like I said, gender-based violence. So that is how we organize ourselves. Thank you very much.
Thanks, Dr. Nicole. Very, very interesting to hear about the 50-50 representation, right? Because when issues around global leadership, especially in the health sector, we have seen that that's not the case. And just hearing just the example with Women in Global Health Cameroon chapter is definitely a best practice there that we can learn from when you have the 50-50 board representation of women and men. So I think just the key highlight there and definitely learnings that we can learn from in Cameroon around leadership and gender equality. I'd like to move on to Dr. Preethi. Let's hear more on Women in Global Health of India chapter.
Yeah, thank you. I kind of want to start by echoing what the others have said in terms of representation. What has been very interesting for the India chapter is we kind of came live with our launch when COVID was just happening. So the launch, which we planned in a physical way, completely had a different, particular way that we had to hold it. And what we felt was this really helped the virtual medium in terms of, one, we looked at who was on the ground level, the frontline health workers. It was primarily the female. We have over 1 million frontline health workers who were, out on the ground during the entire, from the beginning itself. So one of the things that we decided to take head on was, could we get their voices amplified of the kind of issues they have and create a virtual table where not only are they represented, but also have the policymakers, people from the development sector, academicians, researchers be around that same table so they could listen to what the ground level experience was and the others could respond. We did a series of about 10 webinars in the beginning, kind of bringing around the table different levels of frontline health workers from maybe the, what we call as the accredited social health activists or the nurse midwife or the self-help group, or even women leaders at our local government levels. So after doing that, we one of the strategies we felt which really worked was actually just having a lot of local partnership with other organizations so that the voice could be heard. So we tried to design for inclusivity, we tried to design for amplifying the voices. And actually, as of now, we're probably around in our 21st month of existence. And we probably, we've done about 21 or 23 webinars in different ways. So I think we've really been able to make some noise. Thank you.
Well, with the number of webinars you've had, you're definitely making the right noise. And I think just, to sum up with some of the key things that have been mentioned is that, having these conversations, having these dialogues, and have local level engagement is so key when it comes to issues of challenging privilege and power. And just making sure that even the experiences and these voices, especially for people on the community and ground level, is so key to inform some of these key processes. So hearing more about organizing and the amazing work that's being done with the Women Global Health Chapters, I'm even amazed in how you've been able to still organize in the time of the COVID pandemic. And I'm going to go through the panelists as well, because I'm sure everyone else is curious about just some of the challenges. They are definitely a lot of challenges. And I know many in the gender sector, gender mainstreaming and even the work that we do with government and policy spaces is so difficult. But just to hear from each one of you, what are the challenges that you faced within the Women Global Health Chapters, and how have you been able to overcome these challenges? So let's start off with you, Nicole.
Thank you for giving me the floor. So I would say the biggest challenge we face is that women bear the burden of socioeconomic responsibilities. And so there is a lot of patriarchy. Women on one side have to still go on with their familiar responsibilities, and they're expected to still work normally. And so they have less time to participate in our meetings and to come together. And during the COVID-19, that has been really a huge challenge, with women being at the front line and having to fight the patriarchy. And so what we did during the COVID-19 pandemic, it was really strenuous, but we still maintained our network through various means. We had webinars, we have a WhatsApp groups, we have social media, and we started now a high-level advocacy meeting, and women begin to follow us more and to join the momentum. So that is one challenge. And the next one is funding. We really have issues with funding. Although Women in Global Health Global makes give some finances for our activities, it would be great for us to have more so that we can steer the change and sustain our movement. And there's also this misunderstanding about gender equality and why it has to happen. Many people, including women, don't know what is gender equality and why it matters. And that is really challenging for us on the field. So thank you.
Thanks, Nicole, on touching on the challenges, and socioeconomic issues has been a really, really big one. And, just also adding on, I'm loving the comments coming in on chat. Josephine was just adding on that the challenge is bias on women, and something that she has faced as well. And I think that's something you were mentioning, and just saying that people just don't even understand the concept of gender equality, and just that need for those more dialogues to be happening to ensure that people understand this. Some key solutions also coming in. I see someone here saying, Jacinta, saying involving the various stakeholders is a key element to get support and more buy-in with some of these key issues. So thank you so much for those comments. We're loving the engagement from our participants and our audience. I would like to hear more. Let's hear more from Dr. Preethi. Maybe you can share more about some of the challenges you're facing and how you've actually been able to overcome some of them.
Yes, we've had numerous challenges. So I would think the first challenge was, it's actually digital and tech challenges, because we were doing webinars, and we had to make sure everything went smoothly, including, when we were doing sessions with the frontline health workers, we really were very, very careful to kind of ensure that they wouldn't have any issues. So we would do like rehearsals. So there was a whole lot of issues just in ensuring tech challenge, and that can happen at any time. So that was a huge thing, and we kind of got around that. The other was, on one side, we were rolling out all of these events, and we were trying to highlight, women who are really contributing, going beyond the extra mile in COVID. While we were trying to do all of these events, we were also just building our nascent Women in Global Health India chapter. So, ensuring a good membership engagement at the same time rolling out, that was another huge challenge. The way we addressed it was, instead of in terms of forming groups, we looked at what's the work to be done, and we just formed a group around that, and then we just kept moving. So the other issue I probably would highlight would be India's got like so many different languages. So what's the language to go with? And the language we were using was English, which also meant that we were wondering, how do we do all these translations? And the way we got around it was we used the chat, and we used to have people translate in the chat. So we would tell our speakers, you can speak in any language that you want. And then we would just keep translating. And that really helped make people comfortable, speak in whatever language they wanted. And of course, during the rehearsal time, we would ask people, what's the language you're going to speak? And then we would make sure our translators were available. And we have some amazing members who kind of did all of this work. So I think I would stop there, as these were the three big challenges at that point. Yeah.
Wow, Dr. Preethi, I think, those are some of the key issues we need to be thinking about, right? In terms of, if we're thinking about being inclusive with all members, let's think about language barriers and how do we address that, and which you touched on as well. And, keeping members engaged as well. I'm glad you touched on that, by having several webinars and keeping people engaged is so key. But just before I move on to hear from Becca and the others, how did you manage when it comes to data, right? Because people need to be online and there's the data cost. Like, how do we deal with that? Because, this is also touching on and linking on to these socioeconomic challenges that are there to ensure that, members are engaged in the different digital platforms.
Luckily on that part, the work had become virtual for everybody. So a lot of things were happening online, especially by WhatsApp. So even for the frontline health workers, a lot of the messages were going to them as part of their regular work, or their training was happening via WhatsApp. So people were already, in that sense, tech savvy. And I would say we took a lot of help from the youngsters. So if we were asking a frontline health worker, or frankly, anybody, it could have been me also, but when we landed with tech problems, we would ask our kids in the house who were really savvy. So we would take help from, whether it's a neighbor or, it's the people in the house, or it's in the organization, somebody would help out with these kind of things. But so it wasn't so much the data card per se, but we would limit it, so we wouldn't exceed beyond a certain time so that they wouldn't have a problem.
Thank you, Dr. Preethi. Very, very useful advice and guidance to other chapters as well on that. So moving on to Becca, let's hear from you, Becca. Just your experiences of challenges you've experienced different to the others and how you've overcome them. I see someone in our chat here even has a question on, how are people handling the element of culture in the chapter? So maybe you could answer that, or maybe I can throw it to Dr. Choolwe to answer that as well. So Becca, go ahead.
Thank you, Tikhala. So as to not repeat everything that my colleagues have said, because we face a lot of the same challenges. We have a lot of members who have a triple workload already, taking care of children, taking care of elderly, and then also their full-time workload, lack of funding, as Nicole said. These are all challenges, I think, that are quite common to the Women in Global Health chapters. But something that specifically we faced also as the Chilean chapter is that we have been in crisis mode since half a year before COVID began. So we had a social uprising in Chile in October of 2019. I don't know how familiar everyone is with that, but we had a big social movement that rose up to kind of fight against the inequality that was very prevalent in the country, that continues to be very prevalent. And it got very out of control at some point as well, and we had curfews and things like that. So we have been really in crisis mode for a long time, and in a way that obviously made it difficult for us to, for example, meet in person. But it also kind of prepared us for what came afterwards with the pandemic, because we started meeting virtually before even the pandemic happened. Because we had to, because we weren't able to meet in person. And so in a way, this challenge we were able to overcome it, and it even actually served us and prepared us well for what came afterwards with women in global health, with the pandemic. And another thing that I really wanted to highlight as well that I thought was key, mentioned by Preethi, is the language issue, because we have a very similar issue, not that we have so many languages in this country, but that everyone speaks Spanish. And so we have 3 of our members only who also speak English, who are bilingual. And so what we've really done, and I think that this is really something that shows kind of the strength of the women that participate in the chapters, is that we take from our free time to translate all of the important documents. We ensure that everyone knows what's going on. Whenever one of us can make it to a meeting, kind of these conferences, we try to report back to the others, translate the comments, the content. And I think it really just also shows that we do need to decolonize the movement. I think that English is still the language that is spoken, which is understandable because it is the language that most people speak. But I think we really need to start moving towards more possibilities for other people also to engage, because on the regional level in Latin America, we really need to offer things in Spanish and Portuguese so that everyone else can get involved. And this is a challenge that we face, but that, as I said, we have overcome in a way, kind of with the passion and the inspiration that some of our members have to really translate and transmit the content to the rest of the members who do not speak English. So like I said, not to repeat myself and repeat all the other comments that have been made, but I think we face similar challenges, and something that has really helped us as a chapter to overcome, and I'm sure that my colleagues agree with me on this, is kind of the passion that all of us bring to it. We stay up and we do the work that has to be done because we love it and because we really do want to make a difference. And I think that is what has kept this movement going, and will continue to keep it going as well.
Becca, I love it, passion, and just the time that the different members just put into really ensuring that it's inclusive, and then barriers like language barriers are not there, and addressing those as well. So I really love that strength of collective engagement, but just peer learning that's happening among the members as well. So I'm looking at the time, and we've got about 5 minutes left, and I've just been informed that the networking tables will be opened about 15 minutes from now. So we've got a bit of extra time for our session before the networking session happens. So just in case panelists want to go off quickly, just to let you know, networking sessions will start only 15 minutes from now and not 4 minutes from now. So a little more time to kind of wrap up and get the last few remarks. But before I ask all panelists my last question, I want to know from Dr. Choolwe, if you can just share more about the context in Zambia.
Sorry, Tikhala, I think I missed that. I missed that. Would you like to repeat yourself? I'm sorry.
No worries. We're just hearing more from just experiences in country, and we're curious to know what's happening in Zambia in terms of challenges the chapter and members have been experiencing, and how you've overcome them.
Sure, and thank you so much. And I think I should mention that a lot has been mentioned already. It looks like the challenges are quite similar. The context could be quite similar, though different. But just to echo that, the issue of active engagement of chapter members, that has been a challenge. And this is so because, as you may know, the model for women in global health is a voluntary one. And so women have to address the other different competing activities that they have to attend to. And so to actively engage in the activities of women in global health has been a challenge, especially that also we have the issue of data, like you mentioned. Our conversations, our engagement lately has been digital. And as you may know, because of COVID, we have all gone digital and we rarely meet physically. And on this part of the world, meeting physical is one approach that is very, very useful and beneficial. But we've learned to go digital and speak through virtual meetings. And that requires data, which with the issue of economic status of people have to actively engage, they have to make sure they have data on their phone. So that has been a challenge. However, as the leadership for women in global health, we've tried by all means to keep conversating on the WhatsApp platforms. There are times that we observe that some members are quiet. We try to check by picking up a call and check on how people are doing, and also trying to engage them and bring them on board on other activities that they ought to be on. But also I want to mention the aspect of capacity building. We are introducing this aspect of gender equity, and you can see that women are so passionate about gender equity, but we think that for us to adequately be advocates, to adequately pull our chairs to the table, we need to ensure that there's inherent capacity within us, so that as we claim and want to have women on the table, we know what we're talking about. We have tried to do this by trying to mentor. As you may know, we have different women at different stages. We have the young and middle career, and we've tried by all means to ensure that the upper career women are able to mentor young women and provide opportunities, provide platforms for mentorship and engagement. So that's how we've tried to manage the different challenges that I've indicated, including those that my colleagues have indicated. Thank you.
Thank you so much. So for the next 5 minutes, briefly, I'm just going to quickly go around with the panelists. Really would love to hear from you. You know, there's so many existing movements in different country chapters in the regions that we're in and the countries that we're in. Who are allies, right? Just to mention myself being a She Decides champion for the She Decides global movement. I would love to just end off a note on saying, you know, if people could just share briefly, how do we build alliance with existing movements? And what would you love to see when it comes to challenging power and privilege in the next 5 years? Let's start off with Becca.
Thank you, Tikhala. Great way to end this great discussion. I think that the way that we that I would like to see us challenging privilege and power is really what I already said. You know, making these events, making global health, making public health, making women's health, making sexual and reproductive health and rights more accessible to everyone, allowing everyone, whether they speak English, where they come from, rural, urban, whatever it may be, to become a She Decides champion, for example, to join the Women in Global Health movement, to really be able to become part of such an amazing kind of group of individuals. And really be able to make that change, because at the end of the day, the only way that we're going to be able to change the lives of the people that most need it is by including them in the decisions, by including them in the decision-making table. And I think that is really what I hope to see. I'm sorry, I think I forgot the first question that you had asked that I was supposed to answer. Could you repeat, please?
No, Becca, you had said it perfectly, and you kind of summarized the key issues of, you know, working with allies and ensuring that, you know, decision-making platforms, women are there and they're part of the leadership cohort. So everything you shared has been key. Thank you so much, Becca. And I'm just going to move on to Dr. Preethi. You know, Dr. Preethi, with your reflections to end off, I would love for you to also touch on the financing space. You know, what do you want to see? Because we know the women's movement is not funded so well, right? And I'm just seeing a comment on others about saying, you know, what are we going to do about volunteering? We're volunteering all the time. It's a lot of time and there are not enough resources, but love to hear your reflections for the next 5 years. What do you want to see change in this space?
Well, thank you for asking me this such an important question. This is something we debate all the time because, you know, WGH India, we also started as a volunteer movement. And then we were saying, you know, I think Becca has talked about the triple burden, Dr. Choolwe, I think. And we were just adding on to that because yes, this is a movement, but then everybody was spending all their extra time in order to make this movement happen. And again, so when we were volunteering, it's unpaid work for the time that we were investing. So, you know, we kind of really realized if we really wanted our members to work and if we were being true to actually what we were trying to change, then it was very important to also do a lot of fundraising to see whether we can arrange so that even if somebody is giving 5 hours of work, 10 hours of work for something, whether can we pay for it? And this is something that we are trying to make happen in the sense that we've just got a couple of projects. And so we're trying to see, you know, can we make this the norm that even though it is an organization, as in it's volunteer, but then we strive to ensure that all the stakeholders, so I'm not just talking about organizers, but then if we are investing time from a frontline health worker, then could we pay, you know, maybe give her a recharge card for the, you know, for, yeah, so this is something we are trying for. So if you're telling me a 5-year timeline, well, I'm hoping then by the time we would have, you know, found some way to make the funds flow so that, you know, the women who really, if we are to leverage them to leadership positions, really help out, we need to acknowledge it cannot be free, for sure. We would just be doing the same thing again. Yes.
I love it. I love it. Thank you, Dr. Preethi. In just 2 minutes left that we have, if we could hear from Nicole quickly, and then I'll wrap up with Dr. Choolwe. Nicole, your reflections.
On our own part, we really love to
Nicole, are you there? I think we lost you briefly.
Oh, sorry. So on our own part, we really love to see more women to sit at the table of the decision-making room. We have less than 23% of women at the strategic level. So in 5 years' time, we hope that through our actions, we'll be getting more women empowered to strengthen decision making and keeping we
Nicole, I think we lost you, and yeah, we're not hearing you too well because of your connection. Maybe you could just quickly type in what you wanted to say so that we make sure that your reflections are shared. But just to end off, Dr. Choolwe, if you could just briefly share your reflections, plans and visions, what you want to see in the next 5 years, but also key thing working with allies.
Right, thank you. And just to wrap up, I think for the Women in Global Health Zambian chapter, 5 years from now, going forward, would love to see women that are being meaningfully engaged in decision making, women that are bold enough to put a chair on the table and be part of the decision making. And to do so, would like to ensure that women have the capacity, we build the capacity within the women to understand and to know why they need to put their chairs on the table and be part of the decision making. And not only that, would love to see an environment in Zambia that deliberately and actively engages women. And to do this is an aspect where the gender lens will be key for all this, where in every decision making, in every grouping that we see within women, we'll be able to check and see who is being involved in this decision making. And we think that 5 years from now, this should be possible because already we are seeing this among women where they are sensitive, they are able to post aspects which are not engaging women. So yeah, capacity building is critical for us to be able to be at the table.
Thank you, everyone. This was amazing. Thank you to all our incredible panelists. I think we have learned so much about what you're doing with the different women global health chapters. I'm sure everyone who joined was inspired. Hashtag claim your spaces to all the women leaders that joined our session. I think we've learned key things that we've shared today. And please visit the Women in Global Health website to just learn more about the country chapters and also how to get involved in your different countries for those who are not part of a Women in Global Health chapter. Thank you, everyone, and enjoy your next session and the networking tables.
Thank you. Bye.
Thank you for joining, everyone. Bye.
Goodbye.
Thank you. Bye.